Shelby Terry. I'm the program administrator for first episode Psychosis alongside program manager Becky Daughtry. Psychosis refers to a cluster of symptoms that impact an individual's perception of reality and interferes with their daily functioning. Individuals may experience delusions, such as false beliefs. For example, they may think people on television are sending them special messages or that others are trying to hurt them. They may also experience hallucinations, like seeing or hearing things that others do not, or voices telling them to do something or criticizing them. Other symptoms can include incoherent or nonsensical speech and behavior that is inappropriate for the situation. These experiences are more common than many people realize. Each year, it is estimated that more than 2,000 youth and young adults in Washington experience a first episode of psychosis. The longer psychosis goes untreated, the more severe and chronic a person's symptoms may become. Examples include increased rates of dropping out of school, increased substance use, more visits to the emergency department, additional hospital admissions, risk of legal trouble, risk of becoming homeless, and increased risk of suicide or premature death. The average lifespan of people with major mental illness is up to 32 years less than for general population, largely because of increasing risk of multiple chronic disease. However, there is hope. Research shows that early psychosis is identified and treated, the more likely someone is to experience a remission of symptoms resulting in improved daily functioning for the individual and a decreased financial burden to the healthcare system. Coordinated specialty care is the best evidence-based practice for first episode psychosis. In 2015, New Journeys was introduced to Washington's own coordinated specialty care model. This vital treatment provides access to services as soon as symptoms emerge, rather than waiting for someone to become severely or chronically ill. It involves a multidisciplinary team providing a full range of person-centered, community-based services that include an individual's natural supports. The treatment also includes a public education and outreach function that is intended to hasten the identification of rapid referral of youth and young adults experiencing a first episode. New Journeys challenges historical ways of thinking about major mental illness, which often include limiting beliefs and expectations of someone once they've been diagnosed with something like schizophrenia. New Journeys doesn't do that. Instead, this model offers hope and real help to young people during one of the most vulnerable times of their lives. With this knowledge, we know that recovery from psychosis is possible and early intervention saves lives. Next slide. In recognition that delaying treatment can result in loss of family and social supports, disruption of employment, substance abuse, increased hospitalizations, and reduced prospects for long-term recovery, the United States directed in 2014 that set aside funding from the federal mental health block grant be used to help develop first episode psychosis treatment programs. In 2019, the Children, Youth, and Family Behavioral Health Work Group advocated for Second Substitute Senate Bill 5903. This legislation called for creation of the New Journeys Implementation Plan for Evidence-Based Recovery Supports, development of financing strategies for Medicaid, and statewide expansion of New Journeys based on incidents of first episode in Washington's population. The New Journeys Implementation Plan was submitted to the legislature in 2021. This provided a roadmap for financing and expansion of New Journeys. Several of the service components that are included in New Journeys are difficult to fund using conventional Medicaid or commercial insurance. Treatment teams have been financed using mental health block grant 10% set aside and state funds. As directed by legislation on July 1st, 2022, funding for New Journeys was moved from mental health block grant to Medicaid through the implementation of team-based rate, which was developed through an actuarial process using New Journeys service utilization data. State funds are directed to support those who are uninsured or underinsured and services not covered by Medicaid. The statewide plan also emphasized the need for future legislation to mandate commercial parity to ensure these evidence-based interventions are available to those in need. Next slide. There are currently 15 New Journeys teams across 9 regional service areas in Washington. Based on these numbers, there is a clear need for continued expansion of New Journey services to those areas in Washington at risk of being underserved. As we continue expansion through our state, we are focusing on increasing equitable access to treatment for first episode. These efforts will address diversity, equity, and inclusion with the evidence-based work by targeting culturally responsive adaptations of the existing model. These adaptations will aim to better serve those who are American Indian and Alaska Native and those living in rural areas where access to resources may already be limited. In sum, New Journeys is cost-effective and highly beneficial to those experiencing psychosis. Support of this model is aligned with value-based care delivery by redirecting usage of costly inpatient care to lower-cost outpatient clinical services and supportive services. New Journeys breaks down the barriers created by stigma of major mental illness. The emphasis on community education, early screening, and a no wrong door approach to accessing treatment helps remove the silos often seen in traditional outpatient treatment. Thank you for your time. This concludes my presentation.
Thank you, Shelby.